health workers, right? And let's take this story. Recurring strikes by healthcare workers are once again laying bare the fragile state of Kenya's health system, as experts warn that chronic underfunding, weak governance and failure by the government to prioritize healthcare is pushing the sector to the brink of collapse. Even as clinical officers down their tools and nurses issue fresh strike notices, concerns are growing over survival and safety of patients who rely on the strained facilities for care. KTN's Aman Kamariki reports.
Kenya's public health system is once again under strain, with a growing wave of industrial strikes from clinicians to nurses and even doctors. The now too familiar cycle in the country's healthcare story is increasingly being blamed on systematic failures that remain unresolved for years. Clinical officers say their collective bargaining agreement CBA has stalled for more than 8 years, a delay unions describe as outright negligence by employers.
Someone has worked for 30 years, they are still at job group J after they were employed at H, meaning they have only gone one job group. It is very devastating. So unfortunately is that the employer always project and budget for promotion, and where the money goes is what we cannot even tell. So you feel that those staff are feeling unsupported and unmotivated to work. The extent, and that's why the union is there, that we have to act and push the employer to go on strike.
In Nairobi and other major towns in this country, public hospitals are sinking deeper into a crisis, with some facilities left operating on skeletal staff, as interns and medical students struggle to fill the gap whenever healthcare workers take to the streets. Patients caught in the middle are increasingly being forced to seek treatment in private hospitals, where costs remain out of reach for many. The Kenya Union of Clinical Officers now warns that counties are struggling to manage healthcare, with strikes still being reported in several regions.
We talk about referral services being a service that is supposed to be offered by the national government. So then you cannot demarcate or put line in terms of where the county ought to work and where they are not supposed to be. So then what we ought to see in a working situation is where then they are working synergetically to guarantee services. But when you want to say, these are my facility, you can't employ and second staff here, then it become a problem. But also the national government has a responsibility to capacity build the counties, which means that it actually give them a mandate where they can even employ staff, where counties have not enough staff, like the referral facilities, which is supposed to have like 60 clinical officers, they have only 20 clinical officers. The national government can say, I want to employ and second to you.
Stakeholders have also accused the Council of Governors of defying court orders and failing to honor return-to-work agreements, further worsening the stalemate. Healthcare economist Beatrice Kairu argues that the recurring strikes are merely the visible cracks in a much larger problem, noting the unrest is not the disease itself, but a symptom of deep-seated structural failures within the system. Poor working conditions, lack of essential equipment and chronic understaffing continue to define many public health facilities, compounding the crisis. Kenya's health sector has in recent years witnessed repeated strikes by doctors, nurses, clinical officers and laboratory technologists. In March 2024, doctors staged a 56 nationwide strike, while other cadres have downed tools for even longer periods.
We have done our own audit. There have been more than 103 strikes in the health sector since devolution. And the issues that have been informing this strike is the same common issues that we are talking about. However, there have been even sometimes strikes during the COVID time when we were striking to be provided with the PPP, that is the personal protective equipment, PPE, which you'll be surprised to understand that some counties, if you walk today, those are still problems that we normally experience.
The Kenya Medical Practitioners, Pharmacists and Dentists Union has blamed the unrest on poor leadership and weak governance, proposing the formation of a health commission or a return of healthcare to the national government. Similar proposals have been echoed by clinical officers' leadership and the Kenya Union of Nurses, as a pressure mounts on both national and county governments to act.
They are the people who have been given mandate by the people, by the citizenry, who depend on our public sector for services. At any time when the services are not there, it is a demonstration of your inaction, you as the employer. To the extent that employees, like the clinical officer, must go on strike to demand services, it is irresponsible, and someone should be able to take responsibility. So as clinical officers, I will still urge them to be strong, to work together and ensure that we are holding the employer accountable.
Across the counties, disputes persist from Embu to Meru, with the fresh strike notices issued in Trans Nzoia, Isiolo and Homa Bay. Under the current administration, unresolved issues surrounding the 2017 Collective Bargaining Agreement CBA continue to trigger recurring industrial action, with little indication of a lasting solution. And as the standoff drags on, it is the ordinary Kenyans who continue to pay the price, with access to affordable and reliable healthcare slipping further out of reach.